We're just going to bring the patient's knees up. We're going to plant the feet on the table. It's nice at the same level. And once they're at the same level, we're going to look at the height of our knees here. And if they're not the same height, particularly if, let's say this is the hip that's we're concerned about, if there was a dislocation here, it's possible that this knee will be lower and a little more cephalic. Okay? That might also indicate, if it was maybe even a little bit taller, might tell you that we have some tibial problems, tibial length discrepancies on it. You know, we measure patients' legs all the time, right? And so there's a variety of scenarios to weigh. My brother had a fractured, the neck of his femur was just broken in two. He didn't know why. He had fallen into some big window well somewhere up north, and nobody knew what was wrong. He went to an osteopath. This was when we were all kids. I was a kid. Took him to an osteopath. The osteopath measured his legs, and they were so far off. And he just did some manipulation in his back. He said, "Oh, you'll be all right." Wasn't exactly the best thing, but he was walking on it. You know, so it's kind of interesting. Okay, so that's Alice's or Galease's. What's the next test on it? Ortolani's is a test. I want you guys to look on YouTube and look up Ortolani's. That's a test that they use for like little babies, infants, to determine if they have a hip dislocation. And to start that, they'll do a Barlow's test. For some reason, when the child's hip is dislocated but not fully, they can't really feel it along that acetabular rim, so it can be out of place but not fully luxated. So they'll start with a
My bad.
they'll start with a Barlow's test. Minus points, yes.
So does that mean we all get an extra 2 points?
Yeah, we get
Yes,
points.
thank you.
Okay, yes. And Dr. Power, he's going to give you those when he grades you at the end of the quarter.
Yes! On my final practical.
Anyway, they'll do a Barlow's test where they'll bring the patient's knees up. And remember, it's an infant. And they will push through to see if they can't fully luxate the hip. And then when they do the test, they'll realize, yes, it is dislocated. Because sometimes when they're doing this test, and they're feeling like the clicking or the popping or the movement, the child's hip can be dislocated, but it's not full. It doesn't show up. And so they'll literally do this test with a lot of oomph to see if they can't fully dislocate that, and then we'll know what they're dealing with. So the test, they'll pinch the patient's ankles all the way up to their feet, ankles all the way up to their buttocks, and then they'll abduct the knees like this, and they'll be palpating behind the patient's hips, feeling the little infant's hips to see the socket and everything, how it's moving. Okay. So I really want you to go on to YouTube and see how they do that. All right. But remember that they'll begin that with the Barlow's, and of course I want to test you on that on the practical because we're going to have a baby. What's the next test? Eli's, and this is for a hip flexor contraction. You may have heard this. I'm going to have you lay face down. In Eli's, the hip flexor that I want you to think about when you're doing this, because I know you probably had this. You know, when you bring this leg up, we're going to look for the hip to hunch off the table like this, right? As this pulls up, this whole hip is going to hunch up like this. And that's a hip flexor, and primarily the hip flexor I want you to think about on that. And instead of more like a little shove, I want you to think more. So, and that's Eli's sign, because you may be doing like an Eli's heel or buttocks test for, I'm not even sure what that's for, an SI lesion, is that what that is? And this is a sign, so while you're doing the one test, all of a sudden this comes up and you say, oh, I see, there's something else going on here than what I was testing. It's the Eli's sign. The next test? Ober's. Ober's is for contracture of the IT band. So you're going to have the patient then lay on their side. Face the audience. Thank you. Okay, now some people when they're doing this test, they'll take that bottom hip and they'll flex it in the knee a little bit to help reduce the lordosis in the spine. I don't know if that's necessary or not. But you'll lift this up just like this, and we're going to extend it, just like this. And then we're gonna have the patient try to lower it all down gently too. Now, it should all come down parallel to the floor when it's coming down. Some people, when they do this, they pull this up like this, and then as they're holding it here, then they slide this way and they see if this just doesn't fall down this way. You know what I'm saying? But we want to be able to bring this up and back, and you're gonna stabilize in here in the pelvis a little bit, just to see what type of muscle recruiting or whatever they're doing. And they're gonna lower that all the way down, and they should be able to do that, unless they have some type of IT band contraction, okay? Yes?
It says unaffected side is down, so for the test, how would we do that if we're just doing one side? So say like do this bilaterally.
I would do this bilaterally, beginning with the unaffected side, but we don't do the unaffected side here for time constraints, so I'm not even gonna do the affected side.
Oh, then the affected side up.
The affected side is up, this is the side that's the problem right here. Okay? Next. Thomas's test. And there's a variety of ways of doing this. I just put all the contraction tests together. Would you slide all the way down to your, just to your knees or on the edge of the table, on your back, supine. Thank you. Very good. Now, Thomas's test, as you know, the patient, if we're gonna test this iliopsoas muscle or these hip flexors here, we're going to have the patient reach down and pull his, we're testing the left side, so he's gonna pull the right one up, right? You guys, this is somewhat familiar to you? Okay, so what we're looking for when this happens is we're looking for this to come up with it, right? And if that iliopsoas is contracted, it'll pull this up as well. We're also looking to see if we get any type of flattening here, and we have a nice flattening here as he does this. If you don't get any flattening, that can also indicate that you have some contracture of that iliopsoas. Another finding that we might get is the patient starts to come up, maybe this starts to straighten. If this starts to straighten again, we're talking more rectus femoris than iliopsoas, okay? Or it may even be both of them, maybe iliopsoas and rectus femoris, so you have all the hip flexors getting involved, okay? Next test. Patrick's test, and I'm sure you guys know Patrick's or Faber's, right? We're gonna speed up here, if you would. Flexion, abduction, external rotation. And here's the way I would like, you can go up here to make something more comfortable. Let's say our patient's having trouble with his left hip, all right? So what we're gonna do is we're gonna bring the patient's knee up on the table, and I like to do it this way. I like to just start like that and say, does that cause you any discomfort? And of course you would do this on the unaffected side. I think we have that established, don't we?
Yeah.
Okay. So I would ask the patient if this causes any pain. Then I would do a little bit of telescoping. If they said no, then I would do a little telescoping. I'd say, does this cause you pain? And see what he would say. If he says yes, then you say what?
Where?
Where does that hurt? Right? And if he says no, then I'm going to continue. I'm going to bring the patient's knee over like this. And I'm going to have him relax that. And I would ask the patient, does that cause you any discomfort? Okay. If they say no, and I want to continue, the final step of the test that I want you to do is I want you to stand at the bottom of the table. And I want you to get a hold of the knee here, and we're going to stabilize the opposite ASIS. And not only am I going to apply some downward pressure, but I'm going to add a little bit of axial compression to there, because I think you get more effect into that hip. Does everybody see how I'm doing this?
Mm-hmm.
So I'm coming this way, and you say, does that cause you discomfort? Okay? So we're going to need another table in here to test it. Grab a table. Okay, these are still review, right? So I'm not going too fast for you. This is what's the next test?
Leguer's?
Laguerre's. Is that what you said, Laguerre's? Laguerre's is what?
Leguer's.
Laguerre is Faber and the air.
Oh.
Right? Laguerre is Faber in the air. And the best way to do Laguerre's, I think, is to sort of stand square to the patient like this. Reach down and grab. We're going to test the patient's right hip in this case. Okay? And by the way, when any one of these can be positive, and what would be positive, you know, for like these, some type of a hip lesion, right? Could be just an arthritic condition, it could be something worse. You know, so the patient's not gonna say, you know, I have this condition, oh yeah, it means this, it's just, yeah, that's hurting my hip when we do that. So you need to have some further investigation, whether it's an x-ray or something, some advanced image to help us figure out what's going on with that patient, okay? So Laguerre's, the best way I found to do this, and am I doing these similar to the way you've been taught?
Yes.
Just reach down like this and grab a hold of the patient's ankle. Okay, I'm just using my superior hand, I'm standing square to the patient and coming up, grabbing the ankle, and I'm gonna bend this up like this. And I'm gonna hold on to this, and then what I'm going to do is I'm gonna bring this over like this, stabilize it over here, and I'm just going to put the pressure into that hip as I'm doing it in this fashion. Okay? I've seen a lot of interesting positions for Laguerre's. I think that's
The best
easy.
one. Definitely.
What is it?
Scouring.
Scouring. Scouring. How many of you, your first job was washing dishes in pots and pans at a restaurant? That's my job now. Yeah, when I started Dr. Power,